California Department of Public Health is warning about a substantial increase in tuberculosis cases.
Tuberculosis is one disease that seems to be taken for granted by millions of people.
The number of people dying from that disease has gone up.
It is an infectious disease. We use antibiotics in an attempt to kill the organism, but the organism is developing ways to overcome the drugs that we use to treat it.
Caused by the mycobacteria.
Well, hello there. Welcome to another episode with Dr. Mohammed Al-Maltez. In this episode, I will briefly explain something that we usually undergo in the local health centers, and it's something that is very important, especially in the third world countries. And that thing is the testing for TB. I'm sure sometimes you visit the local health center for a regular checkup, pre-employment one, and they inject you with something under your skin, what we call a transdermal injection, and that is called the PPD. So what is this PPD? Is it a police department? No, it is nothing but a purified protein derivative, and we usually see that in patients who have the potential of developing tuberculosis. Tuberculosis is one of the most important respiratory diseases that one must be aware of. You might not have it, however, it usually takes time for it to develop. Most people from China are at high risk of developing that, as well as India. It just so happens that the largest two populations in the world are infected with such a disease, thus raising its importance level. So this injection is basically chosen in any area in your forearm, for instance, and you're injected with that. And then they tell you to come and visit them back in 72 hours. Why specifically 72 hours, you probably asked you. And that is because the immunological reaction usually takes around 3 days for it to develop, and what we better know as type 4 hypersensitivity reaction. So after injecting you with the PPD, what happens is that we assess for the redness, because you probably noticed that you get the area red. However, we assess for what we call an induration. What is an induration? An induration is nothing but a palpable firmness that we feel in the area. You have a very small circular outpouching in your forearm, and thus that could indicate the person has tuberculosis. It could be latent or primary, depending on whatever you find on the chest x-ray. Can I diagnose it when there is redness but no induration? Absolutely not. You will have to find the induration for you to diagnose and further investigate. How do we measure it? You've probably noticed this. If you get an induration, usually they bring a ruler and they check the area. So for 5mm sizes, almost half a centimeter, usually we diagnose people who are immunocompromised. For instance, patients with HIV, patients with AIDS, patients with very close TB contact, for instance, a relative at home, and patients who are on chemotherapy. For the second group, which is usually the 1 centimeter group, and those are high-risk populations. What's interesting about the high-risk population is that it's not only immigrants, we doctors also are susceptible to further workup when we have 1 centimeter indurations. And the last group is the 1.5 centimeter groups, who are usually the healthy individuals who have large induration in the area you've been injected in. Just note one thing: if they inject you in your butt, then you're probably not doing this test. What if you have somebody who develops an induration? Then you'll have to relate that to the, say it with me, chest x-ray. If you like the contents of this video, then I suggest you watch our videos right here. This video about hypertension, which I highly recommend, or this video about epidural hematoma, which I highly recommend again, here. And if you've liked the contents of this video, then please like and subscribe for more videos about healthcare and medicine. Stay safe.